Positron emission tomography. Graphy means recording, tomo means cross section. So we are going to get the cross sectional information of the patient with the help of the positron emission isotope. PET. P stands for positron, E stands for emission, T stands for tomography. Let us first understand what is positron. Basically, it is a particle of matter with same mass as that of electron but opposite charge. You know that electron with negative charge is called as electron, electron with positive charge is called as positron, and this positron used for imaging in PET scanner. This is the device which we call it as cyclotron. Cyclotron is used to produce the positron. So positron is generated with the help of this device called as cyclotron. We call this as medical cyclotron. What is the working principle behind this? It is slightly complicated, but listen carefully. I will put it in a simple language so that you can understand how cyclotron works. Have a look here. Can you see this looks like a D shape, and this is another D which look inverted one. So these two are called as Ds. Two metallic discs called as Ds. These Ds are separated by a small gap, and the whole assembly is going to be kept in between the strong magnetic field. For example, North Pole is there, South Pole is there. So the total device is going to be kept in between the strong magnetic field. We are going to give an alternating current between these two Ds. For example, if this side is a positive potential, this will be a negative one. Suppose this is going to be negative, this will be a positive. So alternatively, the potential will be changed because we are giving an alternating current. Assume that I am going to keep a positive ion source here. When this is going to be of negative potential, what happens? The positive ion will get attracted towards this, and due to the magnetic field, it will make a curvature and come up to this point. When the particle come up to this point, by the time the alternating current will be switched over, this will become negative potential and this will become positive. So the positive ion will be attracted towards this, and once again this will make a circular path due to the magnetic field. But make a note, now the diameter will be increased when compared to this one, because when every time the ion pulls to the next section, it increases the diameter and comes like this. Now this will be negative potential, so it will be getting attracted towards this, and it comes like this. By the time it reaches here, this will become negative, so it gets attracted, and you see this goes in a circular fashion, hence it is called as cyclotron. It means that the ion particle are accelerated in a cyclic fashion, hence we call it as a cyclotron. Once it is accelerated as per the required acceleration, the positron will be diverted from the device and it will be going and hitting the target. What is the target normally we use is oxygen 18. When the fast moving ion particle goes and strikes, it means it gets bombarded the O18 continuously. This O18 will be converted into a radioactive element fluorine 18, which is the positron emitter. I will repeat once again. The fast moving ion particle will be accelerated by the cyclotron, made to bombard on the stable atom O18, and because of the continuous bombardment, this is converted into a radioactive element fluorine 18, which is going to be a positron emitter. That's how we get the positron emitter. So fluorine 18 is the positron emitter which we use in PET scanner. The common PET radiopharmaceutical used in nuclear medicine are fluorine 18, of course carbon 11, nitrogen 13, oxygen 15, rubidium 82. But in PET imaging, what we do at present is fluorine 18. The advantage of this isotope is its half-life is very less, 110 minutes only. But at the same time, we also should be very cautious because its half-life is very less. So as soon as it comes to the site, immediately we should plan to do the imaging, otherwise it will be decayed. So we have to handle the isotope in a careful way, keeping in mind the half-life also. The fluorine 18 is going to be mixed with the deoxyglucose, hence we call it as fluorodeoxyglucose, FDG. As I said earlier, F18 is a cyclotron produced by bombarding O18 enriched water with high energy positive ion particle. Fluorodeoxyglucose, that is fluorine 18 mixed with the deoxyglucose, is going to be called as a FDG, which is a glucose analog. This FDG is used extensively in oncology for cancer diagnosis and staging. So this fluorodeoxyglucose is an ideal component and it gives a excellent biological information. Otherwise we call it as a the functional information, because it involves in the glucose metabolism. Let us see the working principle behind this. Positron emitting tracer is injected into the body. For example, FDG is injected into the body. This radio tracer emits positron inside the body, which normally travels 1 to 3 millimeter only. So its range is very less. So inside the human system, there will be a lot of free electrons will be there. So have a look here. This is inside the human system. When we inject the isotope, positron will be emitted. The positron will travel only 1 or 2 or 3 millimeter maximum. It interacts with the free electron in the human system. When it collides with this, which we call it as annihilation, when annihilation happens, 2 gamma rays whose energy is 511 keV is emitted exactly at the opposite direction. Have a look once again. When the positron collides with the electron, annihilation happens and 2 511 keV gamma ray is emitted exactly at the opposite direction. Now have a look here. The annihilation taken at this point, you assume exactly 2 gamma rays are going to be produced, and that is going to be captured by the detectors surrounded the patient. Since it is going to be captured simultaneously, we call this as coincidence imaging. What do you mean by coincidence? It's nothing but simultaneous detection of 2 photons. Can you have a look here? Whatever happened here, it is detected simultaneously. It is detected simultaneously. It is detected simultaneously. This is the fundamental principle of PET scanner. So, same thing I am going to give in a nutshell. The positron, that is the beta plus, annihilate with the electron beta minus. Due to this, 511 keV gamma rays is going to be produced exactly at the opposite direction, that is 180 degree, and that is going to be captured by the detector, which is exactly 180 degree opposite to each other. And these data are going to be transferred into the system, processing happens, and finally you get an image on the monitor. What is the detector used in PET scanner? We know that sodium iodide crystal is used, thallium doped, in planar gamma imaging, that is a gamma camera. But in PET scanner, we use a different detectors. One is called as BGO, bismuth germanate, LSO, cerium doped lutetium oxyorthosilicate, GSO, cerium doped gadolinium oxyorthosilicate. Commonly we use LSO, that is cerium doped. Any crystal has to be doped with the impurity. So we doped with cerium lutetium oxyorthosilicate. We call this as LSO. Why we prefer LSO? This is the characteristic of various crystals which we use for PET. Only one point I would like to highlight here is, have a look at this point which is indicated in blue color, decay time. Compared to all the crystal, LSO has the decay time very less, 40 nanoseconds. That is going to be a great advantage. First, let us understand what is decay time. If the decay time is less, means ability of the crystal to detect the event immediately. As soon as the one detection happens, it is ready to detect the next one within 40 seconds. Within next 40 seconds. But when you see the other crystal, we have to wait for longer time to detect the next event. So that is a great advantage of a LSO. Of course, quite costlier also because of that. Let us see about the patient preparation and instruction needed in PET scan. You know that NPO is needed 6 to 12 hours overnight, 24 hours prior to the study. Better to have a low calorie meal, avoid exercise, blood sugar has to be checked. Post injection, as soon as the injection is given, we should ask the patient to relax, not to talk. Why? Because when they talk, the metabolism is going to increase and it will alter the actual information. Before the study begins, ask the patient to empty the bladder. During the study procedure, ask the patient to lie still. Ask the patient to breathe regularly. Emission scan, transmission scan, attenuation correction, everything will be done in this, which I will tell when I am going to talk on the fusion imaging. PET room design is concerned, normally you know that in CT scan or X-ray room, the walls are constructed by brick wall. But here, the PET facility, all the walls are all made up of concrete only, and the thickness will depend on the workload. Now let us see a couple of images, how PET images look. This is the normal image. Have a look here. The normal appearance of the kidney, liver, bladder are seen. Look at this. The isotopes are taken in various vertebrae, even in the limbs, the pelvic bones. You see that's a big mass. So wherever there is a changes in the metabolic aspect, the accumulation of activity is going to be there. So you can pick up at the earliest stage. It's very sensitive modality, very sensitive modality. So this is the abnormal case, how it looks in the PET scanner. Once you want to do any cross-sectional information, then you can do whichever area you are interested. So have a look in this. This is a PET image of a case of a CA colon. See, this is a normal image, this is also normal one. But have a look here. Can you see here? This is a CA colon actually. So this is the abnormal region which you are seeing here. This sort of information you can pick up in PET scanner. Similarly, the detection of bone metastasis in patient with high-risk prostate cancer, technetium MDP planar scintigraphy is done. Even we can do SPECT, and of course, fluorine 18 PET will give a better information. Have a look here. This bone scan. This is the PET imaging. See, all the subtle lesion, everything is picked up in the PET imaging. That is a greater advantage of PET scanner. Why PET? Because lot of advantages are there. Metabolic information, molecular imaging, that is a greater advantage. Single test for entire body. Early detection and precise staging can be done. It monitor response to the radiotherapy or chemotherapy, lowering the overall cost of the care, and the avoidance of surgery and less extensive surgery are the real advantage of PET scanner. Now let us see the last topic of our today's session, that is hybrid machines and fusion technology. Look at this image. You know that CT, MRI gives the anatomical information. SPECT and PET gives the functional information. When these two are combined, we call as hybrid or fusion imaging. For example, SPECT combined with CT, we call it as SPECT-CT imaging. PET combined with CT, we call it as PET-CT imaging. We also have combination of PET with MRI called as PET-MRI imaging. This is something like an AVL, that is combination of two modalities, which we call it as fusion imaging. Hybrid units and fusion imaging. What do you mean by that? The union of different things by melting. Fusion imaging is nothing but melting together images from different modalities to create a new type of image or new type of formation of image called as hybrid image. Fusion is nothing but it's a new way to create an image. As I said, we have SPECT-CT, PET-CT and PET-MRI. Let us see one by one. So this is the SPECT imaging. Already we have seen this. This is our normal CT scan imaging. Combinedly we call this as SPECT-CT imaging. I'll show one image about SPECT-CT fusion. This is an image from SPECT-CT. This is an image from CT scan. Fuse these two images, you get an image something like this, which we call it as SPECT-CT fusion image. Similarly, we also have PET combined with CT. We get a PET image, we get a CT image. Combined, we call it as a PET-CT image. What is PET-CT? As I said earlier, it's a device with shared mechanical components providing anatomical information from CT scan and functional information from PET scan. Combinedly, we call it as PET-CT. This is the various devices from various vendors. This is from Siemens, we call it as Biograph. This is from Philips, we call it as a Gemini. And this is from GE Medical System, we call it as Discovery. When you look at the device, can you see it's a two gantry? The first one is CT scan, the behind posterior one, this is called as PET. Combinedly we call it as PET-CT device. When you look into the interior anatomical aspect of the equipment, this is the couch. Can you see? This is the couch where the patient goes inside. The first part is CT scan. This is a component of the CT equipment. And this is the component of the PET. So CT gantry, this is the PET gantry. What is the advantage of PET-CT? It gives the anatomical resolution better, faster scanning, anatomy as well as metabolic information. Both we get from PET-CT. It's excellent for radiotherapy planning, guiding biopsy. It gives an additional anatomical information, avoiding the pitfalls on PET imaging alone. More appealing and convincing imaging we get from fusion PET-CT. There are few limitations of PET-CT. One major aspect is the cost factor, very expensive. Of course, we get motion artifact, attenuation correction artifact. We also get more radiation exposure from PET-CT. Justification, that is doing this PET-CT has to be justified properly. Reimbursement issues might be there in case of an insurance aspect. So a few limitations in PET-CT. How the images looks. Let me show a normal study now. This is a normal PET imaging. You see the uptakes in the various anatomical region in the human system. This is a PET-CT image. This is the axial cuts of the same patient. This one is a case of CA colon. So this is a normal anatomical structure. You see the liver, kidney and bladder. Can you see one area, hotspot area? Similarly, in the fusion imaging, can you see an hotspot area? This is the CA colon case. Now, after identifying this with the help of a PET imaging, you can do a cross section at this level with the help of CT, and you get a better anatomical information with the higher resolution. That is the advantage of doing a PET CT. Similarly, this is an axial cut of the same patient, CA colon. Now, let us see the educational need for the radiologists or the technologists who are going to practice in PET CT or in PET MRI. They should have a basic knowledge about patient care, education and management. Little knowledge about radiation physics is mandatory. Knowledge about radiation biology and protection is also needed. Good knowledge about cross-sectional anatomy, CT/MR knowledge is mandatory for them. Similarly, they also should have fundamental knowledge about the nuclear medicine, radiopharmaceutical used in nuclear medicine, contrast media used in radiology. Finally, they also should have an education on PET CT or PET MRI equipment operation, maintenance and instrumentation aspect, which will give an additional skill to them. That's how the PET MRI looks. This is a PET image and this is the MRI device. Combinedly we call it as PET MRI. This gives anatomical information, this gives the physiological information. What is the benefit of fusion imaging? It provides structural and functional information in the same image. It improves the reading efficiency, improves the confidence in diagnosis when one modality alone is not definitive. Quantification of the difference between the various scans can be done. To conclude, the principles of fusion have existed for many years, and the application of this technique is not confined to medical imaging. Software fusion is like a glue, drawing together images from multiple devices. What do you mean by multiple devices? Maybe from ultrasound, CT, MRI and PET image. So this we call it as a multiple devices, including the dual modality scanners like this and PAC systems, and now even radiotherapy planning system also is incorporated into this. The relationship between software and hardware fusion will become more intertwined in the future, and radiological practice will only benefit from this. And why all of us struggle to learn about all these devices? Do you know why? Ultimately, we do this for a better patient care. Thank you so much.